Hello and welcome. Today, we're going to put on our detective hats and learn how to solve some of the most confusing cases in medicine.
So, a patient walks in complaining of things like being tired all the time, changes in their weight, loss of libido. These symptoms are so vague, they could point to a dozen different things. It can feel like a total mystery. But it turns out, in endocrinology, there's this really powerful framework that helps you cut right through all that confusion.
And to make this super simple, we're going to use an analogy. Just think of it like a company. You've got the pituitary gland, which is the manager who's in charge and gives out all the orders. And then you have the target glands, like the thyroid or the testes, and they're the workers who are supposed to actually do the job. Okay, let's see how this all plays out.
Now, this secret weapon for any endocrine detective, the thing that's going to help you crack these cases, is a simple two-step rule. This is the absolute core logic you can apply to pretty much any case to figure out what's really going on.
It's actually beautifully logical. First, you check the hormone that comes from the target gland. That's our worker. You ask, is its output, say testosterone or thyroxine, too high or too low? Then, and this is the key part, you check the corresponding hormone from the pituitary, the manager, to see how it's responding to that situation. And this slide right here perfectly illustrates the two main possibilities. On the left, you've got what's called primary failure. This is when the worker itself is the problem. You can see the manager is basically yelling instructions, that's the high TSH, but the worker just can't respond. Now, on the right, you have secondary failure. In this case, the manager is the one who's broken. It's not giving out any orders, so the worker, which might be perfectly healthy, has literally nothing to do.
Okay, so the theory is great and all, but what's really cool is seeing this framework in action. Let's apply it to a few real cases and watch how it leads us straight to the diagnosis.
So check this out. On the surface, their symptoms are identical. This is exactly the kind of vague problem that can be really tough to figure out. But if we apply our two-step rule, you're about to see how the lab results tell two completely different stories. All right, the lab results really tell the whole tale here. So step one, we look at the worker hormone, testosterone. And you can see, in both cases, it's really low. So we know the worker isn't working right. But now for step two, the crucial part. How's the manager responding? Well, for the 24-year-old, his LH and FSH are sky high. The pituitary is shouting for more testosterone. That confirms a primary or worker failure in the testes. But for the 45-year-old, the manager is quiet. His LH and FSH levels are normal, which is totally inappropriate. With testosterone that low, the manager should be screaming. And since it's not, we know it's a secondary or manager problem. And this is the real power of this framework. We went from the exact same symptom to two totally different root causes. It's not just about finding out that testosterone is low, it's about figuring out why it's low, which is absolutely critical for getting the treatment right. Okay, let's do another one. This time, we start with chronic fatigue. Again, a super common, non-specific symptom that could mean almost anything. So let's apply our framework, but this time we'll look at the thyroid axis. And what do you know? We see the exact same pattern here. Both men have very low free T4, so the worker hormone is down. But now look at the manager's response. The 61-year-old has an extremely high TSH. That's a textbook case of primary failure, where the thyroid gland itself has failed. The 57-year-old, though, has a normal TSH. And just like our last case, a normal TSH is completely inappropriate for such a low T4. This points us straight to a problem with the manager, the pituitary gland. Now that second case, the 57-year-old truck driver, is especially interesting. Because when the manager fails, the problems can just cascade through the entire system. You see, his vision problems were the critical clue that this was way more than just a simple hormone issue. A problem with his sight suggested that something might be physically wrong up in the brain, right near the optic nerves, which is exactly where the pituitary gland lives. And when the doctors investigated further, they found he had something called panhypopituitarism. That single manager failure was causing multiple worker systems to shut down. It was affecting his thyroid, his adrenal glands, his reproductive functions, all because the head office just wasn't sending out any memos.
An MRI revealed the culprit, a large pituitary tumor, a macroadenoma. This single physical mass was literally crushing the manager, the pituitary gland, and pressing on the optic nerves. This one finding explained every single one of his symptoms, from the crushing fatigue to the tunnel vision.
And really, that's the key takeaway here. Even in a super complex case with a whole cascade of failures, starting with this simple two-step framework led the doctors directly to the root of the problem. It gave them a clear, logical path right through the fog.
This logical approach doesn't just solve endocrine cases. It's a really powerful way to think through any challenge where a system isn't working the way it should. Find the breakdown, and you're already on the path to a solution. Thanks so much for joining this explainer.